Carry on.
Comfort, efficiency, economy, and sampling. Sampling accuracy.
Where's the stress?
Accuracy. This is the findings that...
These are.
Yes. These are the findings that we can find after these procedures.
These procedures.
This.
That's it. So.
This.
These. Let me write it for you. So we have this. Then we have
these.
Double length. These. This. These. Look, with an E and a Z. This. Shit. These. Sheets. This shit. This shit. This shit. These sheets. You got it.
This shit. These sheets.
Perfect. You're good at this, but 30 years of not knowing. Was your English teacher from Spain?
Yes.
I think so.
Yes, of course.
Yes, this is why you have big problems. Because your English teacher was from Spain, not England. Then we don't understand you.
Oh.
It's not your fault.
No. I know. I much worry about that. Because
I'm very worried about that.
What do you mean not? Because, really?
Carry on.
Because we
have time.
a lot of images. Look. So they can read, they can see the images.
Images. Look. Image. John.
Image.
Images.
Images.
Image.
Images.
It's not an S, it's a Z.
Images. Yes. So, hematomas.
Where? What is this? Her or he? Is it hematomas or is it hermatomas?
I don't know.
Why don't we copy paste? I think it'll be hematomas. Okay. Let's see if it's in the dictionary. Here we have it. Oh, but we also have other spelling. Which one is it? Hema or hema?
Hematoma.
Hematoma.
Is this what you're talking about? Thick mass of blood anywhere in the body resulting from an injury or blood disorder. So hematoma, like hemophiliac, no?
Yes, hematoma.
Hematoma, look, E with the two dots. Hematoma. But also, when it's written with the English E instead of the AE, it's still pronounced the same.
Hematoma.
It's the same.
It's the same. The spelling is different, but the pronunciation is right. Hemophiliac, hematoma. Hematoma. That's it. So I will write it for you. Same as on here. I will write it without looking at the screen. And then you can check to see if I'm right. So, H, E, M, T, O, Hematoma. Hematoma. Where's the stress?
Right.
Then look at the screen.
Hematoma.
I'm correct. I didn't look. Hematoma.
Hematoma.
Because you have to think, is this Edward? Does he speak a funny English that's not right? No. This is the Cambridge Dictionary. And
Okay.
it's the same thing as me. Because you want to question, no? Is your teacher telling you the right thing in the church, in the hospital, whatever? Are they telling you the right thing?
Hematoma.
Hematoma.
Now you know it's right.
Perfect.
If you have a doubt, you put it in here.
Hematoma.
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 And look, it's even got the inverted comma. You can see it there. Hematoma. They put the inverted comma in. That means the stress is on the next one. Hematoma.
Hematoma.
They've written it correctly.
Okay. Hematoma.
Mm-hmm.
Seroma.
Seromas. Is that right?
I think so.
We don't have that word, but we have this word.
No.
Serosa.
Serosa or
No,
serosa?
no. It's other word.
Seroma or seroma? What do you say? You tell me. Seroma or seroma?
Seroma, I think.
Okay, seroma. That sounds right to me.
But,
like serum. No, a serum. Like a liquid.
It's
thing.
like a fusion.
Fusion.
A fusion. Like
Fusion.
a vision, but which is
Okay.
collection. But
Okay. Scar.
a scar,
Fat necrosis. No?
fat necrosis,
That's right, isn't it?
fat necrosis,
Necrosis.
necrosis, and architectural distortion.
Architectural.
Architectural distortion.
Architectural distortion.
Distortion.
Okay.
Architectural distortion. These last three are more frequent in vacuum-assisted biopsy. So in this image, can you put the
Your assistant's a
PowerPoint?
bit slow.
In this image, we can see an hematoma.
Ah.
A. E.
Okay. When
Hematoma.
a hematoma. When do we say an and when do we say a?
Okay. When the first letter of the following word is a vowel or a consonant.
Vowel or consonant.
or consonant.
Sound, not letter. Do you understand the difference?
Really?
Yes. So, a hospital,
Yes.
a hematoma, because it begins with a H sound, no?
Yeah. An H letter.
And an H letter. But there are examples where the H is silent, and then it depends on the sound, no? So what are you saying? You're saying a hematos, no? That's what you've written here.
No, but this is no. No, say speak about the picture. So
Hematomas.
hematoma.
A hematoma.
Hematoma. Here you can see
Hematoma.
a hematoma.
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 Mm-hmm.
A hematoma after a core needle biopsy. The scar, fat, necrosis, and
Necrosis.
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 Yes. SS. Necrosis.
Necrosis. And architectural distortion.
Architectural.
Architectural.
Architecture.
Architecture.
Architect.
Architect.
Architectural.
Architectural.
Architecturally.
Architecturally.
Very good.
Sorry.
This is not easy, is it?
Architecturally. Here we can see a very thick hyperechoic line. Thick hyperechoic line that translates the way of the needle in the procedure.
Would you say? The way of the needle or
The
path
way.
of the needle?
The path, yes. Trayecto. Yes.
I think the path of the needle, or
Path.
I don't think it's wrong, but I think path might be better.
Path of the needle.
Mm-hmm.
Okay. Let's now move on to
The way of the needle is a bit like El Camino de Dios or El Camino de Bruce Lee, you know? the way of the spirit or something. You understand?
sí. Yeah.
No?
And
It's a
path is camino.
bit, yes, a bit more. Yes.
In trayect? No.
Trajectory. But
Yes, but
trajectory
it's-
is more like for something you throw, no?
Yeah,
Or
but this
fire.
is throw. The needle
Fire.
is frog.
So it's the trajectory. Like For
Trajectory.
a bullet, no? Trajectory. Like John.
Trajectory.
Okay, because you fire the needle in.
Yes.
Okay.
Let's now move on to what surgical changes.
Changes. So, we have
Changes.
change,
Change.
changes. Because everything that ends in the j sound, in the plural, extra syllable. Change,
Changes.
changes.
Changes. Post-surgical changes. We have here two blocks. Surgery for cancer and plastic surgery. But in reconstructive surgery, reconstructive.
Redo,
Reconstructive.
redo,
Redo.
rework,
Rework.
reconstructive.
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 Reconstructive surgery.
Reconstructive surgery.
Augmentation.
Augmentation.
Mammoplasty.
Mammoplasty.
Augmentation mammoplasty.
Augmentation mammoplasty.
You mean fake tits?
Augmentation mammoplasty.
No?
Huh?
Silicone tits, no?
Yes, that's it.
Yes.
This is silicone.
Reduction mammoplasty.
Reduction mammoplasty.
Oof. Okay. Let's see these words.
Surgery for cancer. Reconstructive.
Reconstructive surgery.
Reconstructive.
Reconstructive surgery.
Reconstructive surgery.
Redo.
Redo.
Rework.
Rework.
Yes,
Reconstructive.
Yes.
Reconstructive surgery. Every change or edema. Changes.
One change.
Two changes.
You got it.
The early changes are edema, hematoma, seroma,
Hemophiliac.
hemophiliac, hematoma,
Homophobic.
hematoma, edema, hematoma, seroma, mastitis, and abscess.
Is this mastitis or mastitis?
Mastitis.
What do you think?
Mastitis.
Because normally the itis is Spanish and the itis is
Mastitis.
Because I've never taught somebody who's a doctor in your subject, but I've had a lot of doctors talking about cancer and heart doctors and all of these doctors. I've had a lot of doctors having classes with me because you have to give these conferences and it's full of super difficult words and nobody understands. So, let's see if I was correct.
Mastitis.
I was correct.
Yes.
Spanish is
sure.
itis. It's just a general rule. Your itis is our itis.
Itis.
Mastitis.
And in American?
Mastitis.
Mastitis. They're changing it to a D, mastitis. And I'm saying
Mastitis.
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 And they say mastitis. But their I is still the same.
Mastitis.
Still the same.
Mastitis.
Mastitis.
So far I've been right, no?
So?
So far I've been right. No, because I've never seen that word before, but I know how to say itis.
Yes, but...
There are a lot of itis.
Are
Give
you
me some more
English?
itis. I'm English.
So.
But I've never seen that word before.
Yes, but if I
Give me some more itis.
didn't say any word before in Spanish, I can read it.
Give me some other itis. What other itis do we have? Bronchitis?
Itis means inflammation.
Yeah, bronchitis. I don't know.
Appendicitis.
Appendicitis.
Appendicitis too.
Yeah, so it's all the itis. Yeah, general rule, itis.
Abscess.
And the plural?
Abscesses. Abscesses.
One kiss, two
Kisses.
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 One
Abs-
abscess,
what?
two
Abscesses.
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 Abscesses. Here. This is an example of post-surgical edema. Here we can see the hypoechoic skin and hypoechoic and thick skin, and most echogenic fat. In this case, almost unrecognizable.
Unrecognizable. Unrecognizable.
Unrecognizable.
Recognize. Recognize.
Recognize.
Recognizable.
Recognizable.
Z. Recognizable.
Recognizable.
Unrecognizable.
Unrecognizable.
Not an S, it's a Z. Unrecognizable.
Well, can we substitute, change this word?
Unrecognizable.
Unrecognizable.
Difficult. Difficult to replace.
These are
One, this. Two,
these are two hematomas. Hematomas. The first one, it's a very acute hematoma. Hematoma.
Hemophiliac.
Hematoma with an anechoic component, hyso and hyperechoic components. Components.
Home. Go home.
Components.
Go home.
Go home.
Components. You got it.
In the second one, we can see this image, hyperechoic, and it seems something solid. It's a chronic hematoma. Hematoma.
Do we agree? Because the dictionary said this, no?
Yes, I agree, but my brain not. Hematoma.
My
brain.
5-year-old actress, she had 1.5 hours this morning, and she had to do the script and pronounce it right and sing and act, and she's 5.
Yes, but she's not a doctor. I am a doctor, not an actress.
And doctors have excuses?
Yes.
Doctors have excuses? It's very difficult.
Yes.
Because when you're 5, I say something to you and you do it. When we're 37, it's more difficult.
Yes.
It's more difficult. How old is your son?
7, 5, and 1.
7, 5, and 1. And you tell them something and they understand, no?
Yes, but they doesn't do it.
They
don't eat.
They don't do
They
it.
don't do it.
But they understand.
Yes.
And they're super clever, no?
Yeah.
They're super clever. You teach them something and they understand.
Yes, of course.
But we're like super old.
Now I am older.
And now we're older and we don't understand so quickly. It's more difficult. It's true. Ooh.
Yes.
Okay. This is an example of a patient after conservative surgery.
This is an example of a patient after conservative surgery,
Which shows clinical signs of mastitis.
which shows clinical signs of mastitis.
I'm guessing hyporemia and hypothermia. Is that right?
Yes, hyperemia and
Hyporemia
hyperemia
and hypothermia.
and hypothermia.
Echographically translates into this image.
Echographically translates into this
Is
image.
it echo or eco?
Echo.
I think so.
Echographically.
Echo-
Echographically.
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 Graphically?
Graphically.
Echographically.
Echographically
I think it's
translates.
that. It's sometimes, because I'm not a scientist, so sometimes
Yes.
I find this a very heterogeneous area. No?
A very heterogeneous area.
Heterogeneous.
Heterogeneous area
In a surgical bed
in a surgical bed
with different.
with different echogenicities.
Genicities. Ecogenicity. Ecogenicities. Ecogenicities?
Echogenicities.
Oh no, ecogenicities. Ecogenicities.
Echogenicities.
Ecogenicities.
Echogenicities.
Genicities.
Genicities.
Ecogenicities.
Echogenicities.
From
From-
anechoic? Is
from-
that anechoic?
Yes, anechoic.
From anechoic to hyperechoic.
From anechoic to hyperechoic areas.
And then we join the two together.
Hyperechoic areas.
It's difficult for me. No?
Yes, I read.
Abscess.
We observe
Follow me.
Ah.
Abscess.
abscess.
We observe the same findings
We observe the same findings
as in mastitis.
as in mastitis.
Sorry, my mistake. As in mastitis,
As in mastitis.
but the collection
But the collection
is most organized.
is more
That would
perhaps
be better. I was thinking that is more comparative. Is more organized.
is more organized.
More organized.
More organized,
Pause. As we can see here.
as we can see here.
Yeah. This is where are we? Surgery for cancer.
Surgery for cancer.
Reconstructive surgery.
Reconstructive surgery.